think it's important to acknowledge, I know there are people in this room who didn't support the health care reform legislation. I think it's important to state that up front. But I'd like to put this quote up because even if you don't agree with what the legislation has and some of its components, I hope we can all agree on the common goal. And what we're really trying to do here is to give all Americans healthier, more prosperous, more productive lives. And I think if we can concentrate on that goal, we can have respectful dialogue and get to the common goal of really improving all people's lives. So the health care reform legislation passed in March of 2010. And why did we think health care reform was important? Well, first of all, you see this first bullet that says there's 46 million uninsured Americans. Well, when we were starting with the reform, that was true, but that number is already wrong. I'm not sure if you saw the latest census data that tells us now we have 51 million uninsured Americans. So just in 9 months' time, we've seen this number go up by 5 million people. That's almost 17% of our population. So we felt that we had a moral imperative to do something about that, that really all Americans deserve to have health insurance. But again, if you don't agree with kind of that moral argument, I wanted to show you some of the economic reasons for it too. As you can see, $2.3 trillion spent annually on health care. That's 16% of our gross domestic product. And there's an estimation that by 2040, without health care reform, a full 1/3 of our GDP will be going to health care costs. We thought that was absolutely untenable. Also, calculations that without reform would be 58 million uninsured Americans by 2020. I actually think that's an underestimate, especially since we've seen now we've already hit 51 million people just in the year 2010. So again, we felt that there was both a moral argument and an economic argument for why we needed to do health care reform.